hope everyone's doing well, particularly managing their anxiety, managing stress. I know that a lot of people are struggling and are suffering because of what's going on. And there's a lot of uncertainty. So I'm hoping that the folks are doing decently, at least trying to manage that. I'm actually pretty excited to do this. I've been trying to get around to do this for a while, actually. In my studies of political economy, I always sort of bang my head against the wall because a lot of the things that seem really complicated to me, like the theoretical stuff is complicated, but we all understand it because it's it's the title of the reason why I chose the title. It's not rocket science. It's the stuff that we live every single day, the stuff that our parents lived every single day, and that's why I chose to call my series. I'm going to start. This is the first episode of a series I'm going to start doing, especially now that I have a little bit more time to actually focus on the series. But it's not rocket science. It's really simple bread and butter stuff. So I'm going to go ahead and get started. A couple of the things that I want to talk about today, just so you know where I'm kind of headed, because I have, those of you that have taken a class with me, or you're my friend or whatever, I have a tendency to essentially just go off tangent and go off track, which that'll probably happen, but it's fine. But there's basically 4 things I want to cover today. So I want to cover the pandemic a little bit, the crisis, and really related to the economy. So I want to talk about the healthcare industry a little bit. I want to talk about why we're in a situation where we have to do the stay-at-home, situation. And a lot of that has to do with the capacity of the healthcare industry in the United States. And so a question that you might have is, how come our healthcare industry doesn't have a larger capacity to deal with something like a pandemic? Which is actually really important considering the fact that we're headed, because of climate change, we're headed in a direction where this is going to be more regular. I posted an article the other day online that said, that people are the polar ice caps are melting, and some scientists went out to the polar ice caps and basically drilled a hole in one of the polar ice caps and pulled out some ice. They dug deep and they pulled out some ice. And they started analyzing what was in that ice, and one of the things that they said that they found at least 23 different viruses that have been dormant for thousands of years. So I'm not trying to do this to panic anyone, but the reality is that this might be, and this has the potential to be, a new type of normal. And really what's scary about that isn't that is the new normal. It's our incapacity to deal with the crisis is what creates the anxiety. It's our incapacity as a system to deal with the potentialities of what's out there is what causes crisis. And so ultimately it's really about capitalism. So I'm going to talk about that. I'm going to talk about rent and the economy. That's actually the main thing that I really want to discuss today is what's going to happen as a result of this crisis. What's going to happen as a result of people not working, people having their hours cut. What's going to happen as a result of, being forced, to make decisions, to make really tough decisions about where our limited money is going to go. And so it's that sort of really fear that I feel like in the climate of today, not a lot of people are really addressing. A lot of people are talking about, rent moratoriums and as I'll elaborate a little bit, it's not, those are massively insufficient. What elected officials right now are doing, the majority of them, I've actually seen a couple of people really stand up, doing really well, doing really good things. But the solutions that people are saying, we have stimulus packages coming, we're doing we're doing eviction moratoriums, those are massively incapable of really dealing with this crisis that's looming. We think that we're suffering now. It's gonna lead to a stagnant economy and has the potential to like sink us into a recession because people are going to be forced to make really tough economic decisions because of their inability to go to work and their inability to have really income. So I'm gonna take a little bit about that, and then I want to talk about like immediate sort of solutions and really long-term solutions. My research is really based on, how do we create different systems that really take care of human need, and what are people already doing out in the world, in the United States, that is trying to shift our economy in a direction that deals with people's and human needs and what people need. And in this case, right now what we need is we need massive investment in healthcare, which this should have like happened a long time ago, and we know we need all kinds of things as human beings, but our system is not geared towards human need; it's geared towards profit. So I think Instagram Live automatically records them. I'm getting a couple of questions, and so I started an IGTV channel, so I think they're going to go into that. So I hope that if not, like if y'all can give me a I think this is automatic, actually. If it's not, if you know how to do that, I would appreciate it because I actually would like these to be recorded. So apologies, I got a question about this. So really quick, let's go ahead and get started with the healthcare industry. So why are the stay-at-home orders happening? Especially, thanks, Noah, I appreciate that. I wasn't planning on going for more than an hour. So if I do, what I'll do is I'll stop it at an hour. If you guys can sort of remind me at an hour, I'll stop it and then I'll jump back on and sort of can do a Q&A. Maybe I can separate it that way. I don't ever plan to go more than an hour, but y'all know me, man. I can talk. So the healthcare industry. Let me start with that. The problem isn't necessarily that this pandemic is, people are talking about, the mortality rates and it's actually not super high. It's not super low. There's been pandemics that have been a lot higher. It's really about, everybody's heard about flattening the curve. Thank you. I appreciate those people who are giving me tips. It's the issue is that our healthcare industry right now does not have the capacity to manage like a pandemic in the sense that like if everybody got sick and even if it's only 3% of the population, there's about 350 million people living in the United States. 3% of that is 3 million people. It's 3.5 million people. And even if it was 2%, it's 2.5 million people. If 2.5 million people get sick severely, because that's the mortality rate. More people, it's more the mortality rate is based on how many people are dying from this, right? That means that, like in the United States, I did a little bit of research before I jumped on. There is only about 990,000 staffed hospital beds in the United States. So we're massively incapable of dealing with 3 million people getting sick. So if that happens, if all these people start getting sick, they're going to go to the hospital. And the mortality rate under normal conditions and the conditions in which people are actually getting care is 3 to 4%. Then the mortality rate is actually going to go higher because there's going to be doctors at hospitals who are going to have to make very difficult decisions about who gets a respirator, who gets medicine, because we're not mass producing these things right now. The Trump administration, refused. Governor Cuomo's New York request to start using the war powers, the defense powers. I forget the name of the thing off the top of my head, but basically to take over factories for the government to produce the things that we need. Usually it's done during wartime. And he's refused to start using those powers to actually start producing all the equipment that not just the respirators, but even the masks, all the equipment that our healthcare industry professionals need. If you look around how like other countries are responding and you see their medical staff, like they're in full practically hazmat suits. Like ours are going in scrubs and like homemade masks, which are not, like super effective. They're better than not having anything, but they're not they're not what our medical professionals need. So the question is really, why is that? And the answer to that is that our system is based off of profit. It's not profitable to have 2 million beds but only need 900,000. In a system that actually cared about its residents, we would have the potential to ramp up to 2 million beds without actually without doing it, or without having them there. There would be a plan for that. But because a lot of our sort of systems, like, the prison system, the educational system, are largely, to some degree, some more than others, but healthcare is really, in the United States, is based around profit. It's not profitable to have a bunch of extra beds just hanging around. And so, especially for the private industries, we do have community hospitals that are that are run by city governments and that kind of stuff. But even those are managed by people who go to school and learn, like, healthcare management from people who are about, really, like, at the end of the day, they're about the bottom line. How many costs can we cut? How much profit can we make? And then when they do have profit, all that money goes back. It doesn't go back to the people who are keeping people healthy and safe. It goes back to the administrative salaries. It goes to kickbacks, to donors for the community hospitals. It goes to, the money like always flows upward. And so, in terms of why the crisis is happening, it's happening because our healthcare system. And again, the point is, I'm going to try and keep it really simple. It's not rocket science. Like, we have a healthcare system that revolves around making profit, and it's not profitable to have staff on standby. Like, if we really cared about healthcare in this country, we would have a reserve. How we have a National Guard, like the reserve, corps that in case we go to war, we have like an extra pot of people that we can draw on. Well, if we really cared about healthcare in this country, we would have the same thing for doctors. We would have the same thing for nurses. We would have people who are trained to assist in those areas if an emergency came up, and it actually would be incumbent upon our elected officials to create programs that do that. That, like, people have skills outside of their particular jobs. So, for instance, like, I'm sure there's lots of people who do home healthcare work, right? Like, how can people, like, some cities have volunteer fire departments. Like, they have their regular fire department, but in case of like a massive fire, they have other people they can draw on. Well, like, that's something that we should sort of do. So, before I continue to get long-winded, our healthcare system is massively incapable of dealing with pandemics because it's run for profit, and it's not profitable to have a bunch of extra materials, a bunch of extra, respirators. It's not profitable to just have those things sitting there. And so we only produce, and we only staff, and we only, what's the word I'm looking for? We only have the materials that we need for the amount that's profitable. One of the things that I wanted to say is it's not even it's essentially based on demand, but it's not even based on just like the actual healthcare that is actually needed. It's based on the profitable demand. So we know that there's like millions of people in the United States that need healthcare that don't have it, and that's demand. But those people can't afford it, and so we don't let them access it. And so it's not even based on a real like open market demand, because if that was the case, the demand is much higher, and we should ramp up sort of the healthcare infrastructure in this country, but we don't. Why not? Because those people are expendable, because they can't afford to pay for the healthcare. And so, and even if we can create a healthcare system that is at net zero at the end of the year, it doesn't make any money, but it takes care of everyone. Well, that's not how capitalism functions. The goal of any sort of society that cares about human nature and that cares about humanity should be to provide services, to make sure that we organize services in a way that at the end of the year, it doesn't matter if the thing doesn't make money. Even if it runs at a net zero, what that means is that everybody's getting paid. All the doctors are getting paid. All the nurses getting paid. All the administrative people are getting paid. All the staff is getting paid. But there is no stockholders making money. It's just the healthcare industry is basically doing its function. Its function is to take care of people. That's a good thing. It's a good thing to have industries that that can operate at net zero. For instance, the U.S. Post Office, it doesn't need to make money. the reason it doesn't need to make money is because its job is to provide a service, and so it keeps its costs low, which is the point of the service. And so any sort of long-term response to really dealing with this question, and this is what some professors or not professors, some politicians are talking about Medicare for all. That's basically what this is. Like really shifting the narrative of providing healthcare away from making it profitable and taking the whole profit like equation out of it, and it's just about providing services. Which for me, one of the things that I find usually lacking in discussions about this is that it's completely immoral to have a system that is about taking care of people be the main motivator for having that system, and the people running the system are really like about profit. And I read a really sad story today, and I posted it on Facebook about a young man who died because of COVID-19 because he didn't have health insurance. Like I think our numbers, everybody keeps posting the numbers and where we're at, and I took a look at them this morning. I don't know where they're at specifically. I think they're massively underreported. One, people can't afford to get tested. Testing costs a lot of money. We don't even have the tests. Sometimes the tests are actually wrong. They're not even that reliable. And so, like, the United States has already reached the highest amount of COVID-19 cases in the world. I actually think we reached that point like 2 or 3 weeks ago that people just didn't know it, and people still don't know it. So, in terms of the political economy of healthcare, as long as we have a system that's based on profit, it's always going to skirt what people need. It's always going to skirt giving people the actual things that that they need to have good healthcare. So let me just sort of go ahead and move on, because I can spend probably. And the thing is, I'm not even a healthcare expert. I don't have a master's degree in public health. I know how systems function within the economy when they're based on profit. So, for more specifics, for more, I'm sure that people can add to this analysis in terms of knowing the actual true cost of Medicare. I've been posting memes, and one of the ways that I deal with, crisis sometimes, and I get this from sort of my community, is we make fun of stuff. We crack jokes because in difficult times it's easy to get lost in sort of hopelessness. And so one of the ways that I grew up, with friends who we'd always clown on each other and sort of make fun of each other. So one of the things that I did, I've been posting a lot of things that I think are sort of funny, but at the same time they're funny, but they're not that funny. And so one of the things that I posted was a CEO. He was of a healthcare, of an insurance, health insurance company. He was completely upset that he's rushing to get masks for his healthcare industry, the one that he runs, and that the manufacturers of masks are charging $7 per mask, and he's completely angry and pissed off about that. When it costs 50 cents to make the mask, at the same time, he never had a problem charging $700 per person for a saline bag. Per saline bag, $700 per saline bag, the IV bags, and those only cost $1 to make. And so, and the thing is, it's not, the irony is lost on him. He doesn't understand why it's so expensive to buy a mask, even though he's engaging in the same sort of behavior. And I think that's one of the sad things, is that the people who are in it don't really understand how this stuff functions, and when it happens to them, they get pissed and they get mad, but they don't recognize that they're doing the same thing. And the reason they don't recognize is because they've been completely socialized into a system where it's normal. It's normal to exploit other people. So that's the pandemic and the crisis. It's important for people to stay home, and it's not because, again, some of us might have healthy immune systems. It's really about us taking care of our immunocompromised people in our communities. And it's really easy to say, I'm not going to get sick. Other people are going to get sick. You're not going to get sick, but how are you going to feel if your mom gets sick and then you find out that you're the one that gave it to your mom, and that she doesn't survive? And I know that's hard to talk about, but that's the reality. And again, it's not because, the problem here, the reason we have to do the stay-at-home order like if you're mad about that, you should be mad at our healthcare industry for not being prepared. And the reason it's not prepared is because it's based on profit. At the end of the day, like my sort of what I try to teach my students is just follow the money. You know, there's no money in having extra beds that are not staffed. There's no money in having, you know, reserve sort of doctor corps. There's no money in having you know, a bunch of extra hospitals that are just empty. And so because there's no money in it, we don't invest in it. At the same time, it's very profitable to have billions of dollars in a war industry. It's extremely profitable to have, you know, like stockpiles of weapons that, you know, like missiles that cost $80,000 each just sitting there. And because that's profitable, we'll do that and we'll invest that. Yeah, so in terms of the Defense Production Act, Noah, can you do me a favor and ask that question at the end? I want to get through a couple other things. So I want to get to really like what I'm really concerned about, and I'm concerned about the healthcare stuff, but I'm actually concerned about the long-term impacts of what us having to stay home is going to do to the economy. And particularly, I'm completely dissatisfied with the responses to people not having money. So one of the things that began to happen, you know, and one of the things we quickly realized is who really runs the economy, who is essential, right? So like, you know, I have a lot of friends who we're all conversating and jokingly we're like, you know, are you an essential worker? Are you non-essential? You know, and so like now we have distinctions about who's essential, and the very same people that we now consider essential, 3 weeks ago we were like, no, like most people would be like, no, they don't deserve minimum wage. They're, you know, it's unskilled labor. And one of the things that I've been telling my students this year is like, I mean, this week is one of the ways. So capitalism functions in a certain way. The reason that some of us can do the work that we're doing, the reason I can sit here and sort of do this, and you know, like as an educator, this is what I do now on Zoom, or the reason I can, even under normal conditions, the reason I can go to you know, to work and teach, is because somebody out there in the world is doing the work that I don't do. And particularly, it's really the basics of life. There's certain human needs that everybody needs in society just to live, for us to reproduce our labor the next day. And so in order for me to go to work tomorrow or you know, on Monday, what I need to do is I need to eat. So where am I getting my food from? Am I growing it myself? No, I'm not. And the irony of the pandemic sort of crisis is that it makes completely clear, like, you know, who the society actually depends on. And the society in this context depends on farm workers. It depends on grocery workers. It depends on truck drivers. And without their work, and a lot of other folks as well, that I'm obviously leaving out, but without the work that they do, we don't eat. Period. Without farm workers growing the food and picking the food, without agricultural workers doing that, without, you know, people shipping the food and transporting the food, without, you know, grocery store people, like, you know, stocking the food and you know, like leaving it there, like we can't go to the grocery store and find stuff, and get stuff and get the things that we need. And so this is what Marx refers to sort of as a division of labor. And it's in the point of in production where we can grow more food than we ourselves eat, that you can divide up groups of people into those who have to do that work and those who appropriate the work of others. And so in this context, one of the first things that started happening when people started like, you know, getting their hours cut and at some point just losing their jobs, like for instance, Cal State Long Beach just laid off 600 student employees, is, well, when people don't have money, what happens? What happens is there's an economic slowdown, and it's not because we're the job creators. You know, we have a lot of myths in the United States about, you know, who actually runs the economy and who should get the benefits. And I'm completely angered by, and this is sort of a regular anger. I've been angered at, you know, like the way the Congress and the, you know, our national elected officials really respond to these issues. You know, within like a day or two of us, you know, establishing these orders, or, you know, like the Trump you're calling for a national emergency, there was a $1.5 trillion loan that was made available to banks. and and for a lot of people it wasn't. So people don't understand that it wasn't necessarily money that was given to banks. It was just money that was made available for banks to borrow from. But still, 1.5 trillion dollars. You know, and one of the things that people don't understand also is that money, the interest rate on that money, is massively low. It's basically made available to them practically for free. I think banks pay less than 1% interest on those loans, but yet students are made to pay at least 6% on their student loans. So one, the money's always there when wealthy people need it or corporations need it. But right now we're talking about a stimulus package, and the House still. I don't know if the House has passed it yet or voted on it yet, but it's supposed to be coming down soon. If it hasn't already happened, there's a lot of sort of back and forth that's happening. 500 billion was made available for industries. And other people have made this point. 96% of those same industries that are going to receive these $500 billion that are going to get bailed out use their tax deductions from Trump to do stock buybacks. That means that like they basically they want to control more of their own company rather than have like consumers like you or I who can buy stock buy that instead of putting it away for a rainy day. And this is the part that pisses me off. It's our tax dollars that are bailing these companies out. It's always our tax dollars that are bailing these companies out. Always. And the thing that pisses me off the most is that these companies don't pay taxes. Like, it's our money. Like, the money that you work hard for, that I work hard for, goes to the national government, and they give it away to corporations without any strings attached. Obama did this, and this isn't something specific to Trump. Obama did this. Rather than asking, those companies for part ownership in the company, like some type of a hybrid public ownership model, like it was free and clear. Here's some money, like so that you can, and what did those companies do in 2008? In 2008, they basically used that money to give executives bonuses. AIG was the main culprit that made the news. But they basically it's basically highway robbery. So like we're in the middle of a pandemic. Corporations are going to get $500 billion tax breaks, and the industry that actually needs the money, the industry that actually right now, even if it is for profit, like let's put that aside. The industry that needs the money right now is the healthcare industry. They need to massively ramp up production. In terms of what some of the folks are already saying, like we need to produce more respirators, we need to produce more equipment for our health emergencies. Let's put aside that it's for profit. They are barely going to get $100 billion. Like non-essential businesses, like the tourism industry, like the cruise industry, like airlines, like they're going to get $500 billion just to keep them afloat between now and whenever this sort of stops. But the industry that actually needs money to actually deal with the pandemic and to get us through this thing, hopefully quickly, like they're only going to get $100 billion. So I find that massively it's a slap in the face. The other thing I wanted to get to was this. So one of the things that I'm really pissed off about, and again, I'm like all over the place because I get, I get mad about shit, and so like I start talking about it. Apologize for my language. I kind of grew up in the hood, so that's always kind of stayed up with me. Like, I talk the way that, we talked. One of the things that is a looming, really, for me, the economic crisis that's coming, it's not the one that already hit. The one that already hit is bad enough, but the stimulus includes this, $1,200 that people are supposed to get. Earlier, I saw a couple of memes that I thought were really hilarious, and I actually added to one. Is that like the $1,200, a one-time payment. You can get a little bit more if you have some kids, if you're married. It goes up and it goes down. So one, like the people who are actually out there, a lot of essential people, like a good portion of them, not even going to get that stimulus. Because a lion's share of the people actually producing the food that we're eating, that we're relying on, that, a couple of weeks we were making runs on grocery stores and, panic buying, are undocumented. And those people aren't going to get a stimulus package because even if they pay taxes, a lot of them actually have an ITIN number. They have a number that they use, and they pay taxes. They pay sales taxes. Even if they don't file federal taxes, they pay sales taxes. These are people who contribute to our not just our economy by providing the food that we eat. These are people that contribute to local city politics. These are people who pay sales taxes that cities use to provide essential services in the city, and they're not going to get any stimulus package. And if their jobs were cut, and even if they're not, even if they're working, a lot of the service industry, though, workers aren't going to get that. Like, maybe farm workers are still working because we need the food, but a lot of restaurant workers, a lot of people who do domestic care, a lot of people who do like even gardening, right now they're laid off. They're not going to get anything. And so on April 1st, in a couple of days, they're going to have a really difficult decision to make. They have a limited income or no income coming in. Maybe they have, they're part of a family, and maybe somebody in the family is providing some money. They're going to have to make a choice. Even if you have a stimulus package, you get this $1,200, you're going to make a choice. Are you going to feed the landlord? Are you going to pay the rent? Or are you going to use that money to actually spur economic activity? Because you can't do both. When you're on sort of limited income, which millions of people right now are, I read the figures, about 3 million people, and again, this is who qualifies. These are people who qualify to apply for unemployment. This is the highest amount of people that have ever been on unemployment since we kept track of this stuff. This is more people that are on unemployment that existed during the Great Depression. And obviously, you can say, well, we have a larger population today, but even if you take that out of the equation, it's massive. What's going to happen is that on April 1st, I have whatever little money I have, and I'm going to be forced to pay my rent. Well, what's that going to do to the economy long term? And this is, I think, what I think is really, really revealing about our economy is one. I read a lot of different political economy texts, and I think it was Maurice Dobb who said that we don't actually live in just one economy. We live in layered economies. We live in layered economies. We live in economy capitalism is the dominant one, and capitalism is people a group of people who are known as the sort of the owners own the means of production, and another group of people who don't own anything except for their labor power are workers. Within that, though, you have another group of people who just own properties and hoard properties, and people are forced to have to pay rent to them. In California, over 50% of California people who live in residents are actually renters. In some cities like LA, it's about 64% of people who live in the city of Los Angeles are actually renters. So a lot of these people who are essential, fast food workers, and I apologize, I wasn't trying to say that they're not essential, but a lot of these essential workers, they're slowed down at restaurants. So one of the things that I think is important to talk about is that a lot of these workers who are now, they're basically what some sort of people who study Latino. This comes out of really Latino political economy, but it applies to other workers as well. Is that Latinos and brown folks in this country, and it's not just brown folks in this country, it's also black folks, it's white folks who work in these industries, are what are referred to as economic shock absorbers. They absorb the shocks. And the irony here is that, we're talking about this crisis, which is affecting, kind of everyone. These workers, these fast food workers, these people who work in the restaurant industry, they're always in crisis. 3 weeks ago, before this, or a month ago before this sort of started happening, they were already facing, gentrification. They were already facing, rising housing costs. They were already facing all these things. So this crisis is not new to them. The new piece is that now they have less income than they even did then. And so they're going to be forced to make a decision. And in terms of my dissatisfaction with the governor today signed an executive order to give, rent eviction moratoriums. And it comes with all kinds of red tape. Like you have to give, your landlord 7 days notice, and you have to keep records, and like, all kinds of stuff. Well, one, not everybody who works actually works legitimately, right? There's a lot of people who do work under the table, and we're able to pay, their bills that way. And so one of the things that's going to happen is people are going to have to make a choice. And I keep repeating this part, so I need to stop. I don't elaborate. Let me elaborate it. People are going to have to make a choice. Do I pay my rent, or do I go out and buy the things that I need? And this actually historically, this pits capitalists, which own businesses, with the aristocracy, or in our today, in modern aristocracies, the landlords. And this pits them against each other. I have some friends who actually own some businesses, and they don't have people frequenting their restaurants, and they're going to have trouble paying the rent. And so landlords are hoarding, basically, like, in the reality is that most landlords in the United States and most landlords in California are not small, like, landlords who, they own their own home and they might own another property. It's, these companies are massive corporations. The majority of rented places in this country, the majority of property owners that rent out are owned by like massive giant corporations. And these people can weather a month or two of not getting income, because they have reserves. The money that most of us pay to these giant corporations, just all it does is it goes to sit in some account to make more money. They're not dependent on it. And even if they are dependent on it, I want you to think about what that means. Somebody else is dependent on me working a full month and paying a portion of my income. They're dependent upon me for their livelihood. Now, there's a name for this. I don't know if you guys know what this is. And like, if I was doing my Zoom class, I'd wait for you all to answer. What is it called when one organism lives off of the fruits of another organism? There's actually a movie that just won an Oscar about that. They're called parasites. Like, this is literally a parasitic economic relationship. Like, that there is people out there in the world whose only source of income is other people working really hard and relying on the Housing of Urban Development, the Office of the Housing Urban Development in the United States defines affordable housing as less than 1/3 of your income. Even if it's 1/3 of my income, that means that like 1/3 of what I work goes to feed somebody else who didn't build the housing. They just happen to own the housing. I won't get into sort of I can go on just like one segment on the history of like how land ownership sort of was constructed in the United States through racialized policies, specifically through redlining. How these people come to own the land, and how they hoard this. Has a lot to do with sort of how people got wealth, and a lot of that has to do with racialized policies. One of them included is like I mentioned, the redlining, but sort of I'm detracting. I'm going off on a tangent. The point is that these people are non-producing, and they might have jobs and they might do other things, and that's fine. But like, being a landlord is not a job. You're providing me housing. Well, did they build the housing? They paid for the housing 30 years ago, 40 years ago, and they're going to own this property forever. Their family's going to own this property forever. Like, for me, that's just immoral. It's immoral to allow people to basically live off of the work of others in perpetuity. And what in perpetuity means is that, their grandkids, their grandkids are going to own this property, and they'll always have a source of income that they had no like role in really like building. So for instance, the building that I live in right now is actually owned by, this little old lady, and she owns a bunch of different properties, but eventually she's going to inherit it to her daughter and maybe some of the other kids. And those people had no role in constructing this building. They didn't buy it initially. They didn't, decide, how they wanted this building to look, but they're still going to get my income. And so on April 1st, what's going to happen is people are going to be forced to pay their rent, but that means no income to like, or no money, no disposable income to go and spend in the economy. And this is what I'm really actually worried about, is the long-term economic stagnation effects of the long-term economic stagnation effects of being forced to pay rent. So the moratoriums on evictions. Okay, so I don't have to pay it right away, right? But then what happens? I think according to the policy, I have 90 days to pay that month's rent. So then in May, on May 1st, like my rent is close to $2,000. Average rents in LA, let's say for a 1-bedroom apartment is $1,755. Let's say that you live in a 2-bedroom apartment with your family, $2,235. So one, your stimulus check doesn't even cover half of that. Two, like on May 1st, you're or even if you have 90 days in June, like how much are you gonna have to pay in June? Basically 3 months rent. And so even if you give me a year to pay it off, what you're doing is you're undercutting my ability to go and contribute money to the economy, because I got to pay some parasitic landlord. And so what that does, that's going to have a negative long-term effect on the economy, because one of the things that actually gets the economy back up and running is effective demand. And so effective demand means, like, if I go and buy, some bread, that means that there needs to be a baker there. If I go to this bread place and buy some bread, the baker is there. That means he or she has a job, and that means that they're earning some income. That means that they can go home and also buy some of the things that they need, and that means that they go to another business. And so, in sort of economics, this is known as the multiplier effect. The multiplier effect is really good because it creates jobs. So $10 of economic activity that I put into the community, and this is really kind of based on Keynesianism. This is how we actually got out of the Great Depression. We got out of the Great Depression. By this idea that you just got to give people money. It doesn't matter for what purpose. It doesn't matter. You don't means test it. You don't, create conditions like only if you have this amount or that amount. You give people money because working people and poor people are going to do what with that money? They're going to spend it. They're going to spend it because there's things that they need that they've been holding off on. And so they're going to spend it. And when people spend money, it creates demand. Demand is what creates jobs. The more people go out into the economy and spend money, that means people are going to have to employ more people. More people employed, that means that they're going to create more demand. It's what, Robert Reich, who, he's a liberal let's say economist. He was a former Secretary of Labor. I kind of like him. I disagree with him on some of the structural stuff, but this is not a Marxist sort of ideology. This is liberalism, right? It's good because it creates demand, and what that he calls it is the virtuous cycle. And it's not just even about creating jobs. It's also about what happens with like where cities get most of their money. They get most of their money from tax revenue. Well, where does tax revenue come from? Sales tax. So if I'm giving most of my money to my landlord, that means I don't have disposable income to go out and use in the economy. And that means that I'm not contributing either to creating jobs or to paying into the sales taxes that the city uses as a mechanism to fund its public resources. So what's going to happen if people aren't shopping, in a month or two because all their money is going to rent is going to be sort of the collective effect is that city governments are going to run out of money. And there's some sort of, I have ideological sort of, like, I honestly don't care if the city of Long Beach doesn't have money to provide to certain sort of segments that they think are essential. And I won't share them here, but I care about sort of them not having money for firefighters. I care about them not having money for, schools. I care about them not having money for, like the healthcare industry, like homeless shelters, a lot of those things that I think are essential. I think that's important. And so essentially, this is what's going to happen if people are forced to pay rent. This is why I think, and I'm sort of going to move to sort of one of the solutions, because I can talk about some of this stuff forever. But the thing is, I forget. I don't need to put everything into this segment, particularly because I'm going to do some other ones. Like one of the things that I'm really upset about is the moratoriums on evictions. It's all fine and good. That's a good start. But what we need is like an absolute across the board, just, like, call it a rent freeze, call it a rent moratorium, call it a rent suspension, call it whatever you want to call it. But, like, we need to stop rents, period. Because that money, even if you think about it as a stimulus, like, that money is going to get put directly back into the economy by the people who need things. It's not like, like, what are you going to do with, or like my rent, it's $2,000. What am I going to do with that? Am I going to hoard it? Oh no, like my $2,000, don't put it in, put it under my pillow. Like, no, I'm going to go out and buy stuff. I'm gonna go out and buy, buy stuff that I need, stuff that I've been holding off on, even if I use it for, like, things that like, things that are not necessarily essential. It doesn't matter. It creates economic activity. It creates sales tax. Even, like, yeah, I've been wanting. This is on a personal note. I've been wanting to buy like a new DJ controller system. Like, even if I use my stimulus check for that, like, I'm spending it. That means that somebody has to be employed wherever they sell this thing. I pay a sales tax on it. That sales tax goes to the city. The city has money and resources and revenue, so it doesn't have to lay off people. In the health department, it doesn't have to lay off people in all these areas. And so, and this is a difficult choice. And I don't think people are really discussing this in the context that they should be. I don't think people really understand the long-term effect of people being forced to pay rent when they have no money. I'm lucky that I'm still employed. I'm privileged in that sense, but I come from a community where I know it's gonna be really hurtful to them. And if we want to really recover economically from this crisis, if we really want to recover from this crisis long term, and we want to recover quickly, it's incumbent upon all of us to actually reach out to our elected officials and to tell them we want a no questions asked across the board rent freeze. And if there is small landlords out there who depend on some of these rents to live, and that's fine. Like, I'll concede that to some degree. Okay, like, let's help them out too. Let's give them some kind of incentive also. Let's give them a stimulus. Using some city money for that. That's fine. I have no problem with that. But considering that the majority of the people the majority of rented properties in California are owned by large corporations, and this is true across the board in the United States, like, those people, they don't need that money. That money is just gonna get hoarded, and so, like, and they can live without 1 or 2 months rent. And so if you think about, okay, if they're forced to pay even 2 or 3 months from now, like, they have the back rent, like, so okay, so now I have limited money. My job hasn't gotten me fully employed yet, and I'm speaking sort of in the context of other people. So now I owe money. So now I owe, and rent isn't cheap. Like I said, average rent for a 2-bedroom apartment in Long Beach in LA County is $2,235. So now I owe that much for April and May, and then I also got to pay it for June. And so, like, that's going to completely bleed people dry, and it's going to not allow. What I was talking to an economist the other day, he was talking about taxable sales, and that's really going to hurt, and nobody's really, like, forecasting those things. And so the immediate solutions to some of these issues is just give people a break, man. Honestly, give people a break with rent, even 1 month, like, with no questions asked, no paperwork you got to file. Just, we're in the middle of like a life altering pandemic, and you're asking people to fill out paperwork to let their bosses know. If you actually read the eviction moratorium, they can still evict you, just not right now. So they can file all the paperwork, and then 30 days from now they're going to kick you out. And so, like, even if they can't kick you out within the 90-day period, you can still get kicked out eventually if you don't pay your rent. And so it's just completely problematic, and I think it's something that our elected officials are really failing at. Honestly, they have the power to completely stop this, and they have the power to do this as an emergency sort of thing. Just the same way they have the power to deploy all kinds of police officers to go police empty streets. They have the power to do all of that, but they don't. And so, I have a good suggestion that you would need to represent yourself or get a lawyer. Like, who has the time to do that in court when they get an eviction notice 90 days from now, when I need to go work because I eventually want to be able to pay my rent. And so there's a choice. like rent freeze, rent moratorium, rent suspension, whatever you want to call it, like without having to back pay it. That's a short-term solution. Long-term, though, I think really cities and people need to get towards building like a different kind of ownership model. If we see and we understand that landlords are to some degree or like a whole degree, some people are like, no, but my family, they own a small bit, we provide housing for others. That's a terminology that people are starting to use to make it sound a lot nicer. A housing provider. Like, no, these are parasitic economic relationships. People are living off of your labor. When you pay rent, that's your labor that you're paying for rent, and it's going to someone else. It's not going to yourself. And also, don't get me started on the housing market and how it's purposely kept small. But the long term, what we need to do is we need to move to the community ownership models, where communities own properties for themselves, not for profit, where communities own housing for the sake of having housing, not for the sake of creating profit for other folks. I think it's incumbent upon us to start thinking about how we come together to I saw somebody post on somebody's Facebook earlier, like, hey, maybe we get, instead of using this stimulus money for stupid stuff, like, like I said with my DJ stuff, maybe we start pooling that money and actually start buying properties, so that like we take properties off of the for-profit market. And I think that's part of the long-term solution. There's a lot of other things, but I think our governments are being negligent in really dealing with the essential workers and the impact that they're going to have come April 1st when rent is due. Even if they're at grocery stores, a lot of they're overworked and tired, and they're getting a lot more hours, but some of them have even cut back on staff. So the immediate thing that's pissing me off is basically like, we need a rent freeze. Considering that most of the renters in Long Beach, most of the people that live in Long Beach are renters, it's over 60%. In LA County, it's over 60%. In the state of California, it's over 50%. We need something to really long-term deal with this. The fact that 3 million people have applied for unemployment doesn't even begin to capture how many people are actually unemployed. It doesn't begin to capture that because, again, it doesn't account for people who are not looking for work. It doesn't count people who are not eligible to apply for unemployment. It doesn't count a whole lot of other people. The fact that it's 3 million people, like statistically, like those are the people that qualify. I have maybe like 5 more minutes, and then what I'm gonna do is I'm gonna stop it, and I'm gonna jump back on for folks if they have questions. That way, like, my video doesn't get cut off. Or I can actually just continue. It's gonna stop at 60 minutes anyway. We can continue, and it'll only save that part. So basically, a couple of things to kind of reiterate. The healthcare industry is run for profit. That's why it can't manage, the 2 million people that we need. The unemployment statistics, like that I just shared, I've been reading the 3 million people. There's 3 categories of people that unemployment statistics never capture, never talk about. The underemployed, people who have to piece together multiple jobs. It doesn't capture people that are called, marginally attached. People who just gave up, were looking for work because they couldn't find it. This actually happens to sort of coincide with another one. Doesn't capture felons or like people who are in prison, and it doesn't capture undocumented folks who also struggle and are seasonal. And if you accounted for those people, you're talking about, in the millions. Trump was touting that he had the lowest unemployment figures. Yeah, there's low unemployment, but everybody's got 2 to 3 jobs, and so it's not like people are like fully employed. And so, like, that aside, like, there's a whole bunch of other people who are going to suffer. And I feel like the very basic thing, this is a basic thing that people can do, is when I say people, I mean our elected officials, is to do a rent moratorium, like, a rent suspension, like that you don't have to pay back, and to use that as a stimulus package to get the economy back up and running when this thing passes, so that we can get back to the business of, like, getting people employed and getting people back to work. And don't get me started on even that piece. Like, this is like taxes and rent. Like, some of my other videos are going to cover even the exploited, like, nature of regular work and how much money actually is stolen from us on that end. So, like, we're having money as workers being taken out of both pockets, and it's completely immoral. And I think we need to move in a direction where we create an economy that works for workers, that workers get to control, and that workers get to sort of decide for themselves what they want to do with the income and how many hours they want to work, and where workers own their own housing, and where workers own their own, and not like individual housing. I'm talking about sort of collective, like property ownership, community owned, in different models. I don't have one particular thing. I'm not saying we need to advocate for the state to own everything. I actually don't believe in that. I think that also creates a power discrepancies and dynamics. But yeah, so I'll end it there. Again, I'm pissed that not more is being done by our elected officials on just halting rents. I mean, El Salvador already did that. Other countries understand that this is going to have a long-term health effect. I mean, not health, well, health effect and also economic effect. If people have to choose between paying rent and spending money in the economy, they're going to have to pay the rent, and that means that we're going to be in this economic crisis for at least another year or two, and it could have even longer term effects than that, which is what Robert Reich calls the vicious cycle. And so I'll end there. If folks have questions, I know that there was a couple of questions. Noah asked a question about the defense. Let me see if I can go up here and find it. That Defense Act and getting people the things that they need for the if Noah, if you're still there, can you just ask the question again? He might have logged off. Any questions? I'll take questions now. I found it, I think. He said, can you explain how the Defense Production Act may be able to increase capacity for resources? Or is it another way that it will cause the money to trickle up rather than... It's going to do both. So if the Defense Production Act actually is used by the federal government to basically take over companies and force them to make the products that our healthcare industry needs, it's a good thing because it gets the products and the things that our healthcare industry needs, masks, respirators, all kinds of hospital equipment. It will get that. But at the end of the day, they're going to be paid fair market value for those things, and people are going to be charged. So if I get sick with COVID-19 and I go to the doctor, I'm going to pay for that, and I'm going to pay market value for that. And so these industries are not in the business of giving out free healthcare. So the stimulus package doesn't cover any of that. The $100 billion is for them to buy these things from wherever they're made. If we use the Defense Production Act, it's just to ramp up the supply of these things, but it doesn't say that these things are going to be free. Like even during World War II, like we actually made a lot of corporations, a lot of consumer good corporations shift to producing for the war, but they were paid fair market value for those things. So it is another way that money will trickle up. These healthcare industries are actually going to make a shit ton of money doing that. At the same time, we still need to get these supplies to our medical staff. I had another question about what are our thoughts on fast food chains. I got 26 seconds if this ends. Let me just end it, and then I'll come back and answer the questions. Fast food chains being open. I think Bede actually answered that, but I'll touch that. So I'm going to log off, and then I'll log back on live so that if folks have questions, they can ask them, okay?